Hello, everyone, and welcome to Combat COVID-19 Community Support. Today, we have a really exciting topic around managing sleep and anxiety issues during COVID-19. We have two fabulous guest speakers, Dr. Jason Prinster, a psychologist from High Lakes Healthcare, and Becca Mataya, the Director of Primary Care at High Lakes. But before we get started, we do have a couple things to talk about. First of all, who are we? Well, my name is Dawn Creech, and I'm leading up this effort here in Central Oregon. We are an informal coalition of healthcare providers and community partners working together on a series of live stream and virtual groups, really focused on how to care for you and your family's health during the pandemic. And we're funded by the Central Oregon Health Council. Just a quick plug for some of the topics that we have coming up. Actually, we have two live events happening tomorrow. At 10 a.m., we're having a focus on older adults and some of the worries that they may especially have around COVID. And at 2 o'clock, we have Dr. Travis Moncho talking about managing your diabetes at home. Next week, we also have a stellar lineup, and I'm not going to go through all of those, but I would encourage you to go to our Facebook page where we have the schedule of events. And also, as of today, we are also broadcasting, so you can subscribe to our YouTube channel. And with that, before we get started, I do have to go over our really boring disclaimer, so bear with us for just one moment. This event is provided only for informational and educational purposes. It is not offered as medical advice or medical opinions. You should not treat this event as a substitute for professional medical advice or care. If you do require assistance with any mental health or medical issue, please contact your healthcare provider. We make no guarantees or warranties of any kind, express or implicit. Thank you for bearing with us. So now we're going to hand it over to our guest speakers, Dr. Prinster and Becca from High Lakes Healthcare. And with that, go ahead, Jason.
All right. Thank you, Dawn. Thanks for having us. And anybody who's watching out there, thank you for participating in this. We are coming at you from High Lakes Healthcare. Just to introduce both of us, or I'll introduce myself first, and then Becca, you can introduce yourself. I am a psychologist here at High Lakes. And I'm the director of our integrated primary care program. So what we do here is provide primary care services, except my niche in this is providing behavioral health services in those clinics right alongside our primary care providers, our physicians, nurse practitioners, and physician assistants. So that's kind of my role here. I'm really interested in helping out the community and then also our large patient population here in Central Oregon. So Becca, do you want to introduce yourself?
Yeah, I'm Becca Mataya. I'm the Director of Primary Care here at High Lakes Healthcare for all 5 of our locations in Central Oregon, so Bend, Redmond, and Sisters. And I'm really excited to do this talk today because so much of what we think about when we see our primary care physician is our physical wellness, but we don't really often think how our primary care physician can help us with our mental wellness or our emotional wellness. And so I'm excited to have this conversation here with you because these are conversations that we have within the clinic frequently.
All right. Should we move on to the presentation here? I lost the slides. I can't see the slides. Wait.
You should have them. Are you seeing coming back to you should be the slide?
I can't see anything. I can see Becca talking.
Oh, it's because, yes. Hey, Dawn, could you stop your screen share for a second, please?
Okay.
There we go.
Thank you. There we go. Okay. Sorry about that. So the topic that Becca and I wanted to discuss today was just stress. I mean, this is a really unusual circumstance for all of us. Everybody is experiencing some form of stress. And this is normal. One of a conversation that I have with people every day, and I think we all have with our families and our friends, is that there's a lot of uncertainty. There's hardship, both here in our community and also in the world. And this leads to anxiety, fear, which again translates to things like disrupted sleep, fatigue, physical discomfort, and other stuff too. And this is really normal. So I think that's one of the things that we wanted to talk about, was partially normalizing this for everybody, and then also discussing some of the things that are really helpful for people coping with this, particularly anxiety, worry, and then sleep difficulties that people might have.
So in terms of normalizing it, this is not necessarily one huge event that is just going to add a tremendous amount of stress. We're not talking about a very significant thing per se, not that COVID isn't, but it's the small things that really lead up to attributing to fear and anxiety. So for example, you have a stressful day at work or a stressful day homeschooling your kids, and so in order to feel better, you stay up late an extra hour watching your, favorite binge TV show. And then the next morning, you're too tired to get up to do your normal physical yoga practice in the morning. And then by lunchtime, your body needs more calories, so you go get a burger. And then by the afternoon, you're kind of falling, and so you go get a latte. And then by 10 o'clock that night, you're wired and you're, stressing over all of the things throughout your day. And then the cycle just starts to repeat itself. So I think it's things as simple as that can get you out of your really good self-care routines that lead down the path of, this cycle that just kind of creates more fear and more anxiety.
Yeah, and that's a really great example of how there can be a chain reaction. One thing can lead to another, and this is all in the context of everything that's going on: layoffs, IRAs, 401ks tanking. Looking at all the distressing things that are occurring in the news. It has a ripple effect, through our society, but then also through ourselves. Individually, in our health and well-being. So that's what we're going to talk about today. Can I move to the next slide there? All right. So I still can't see the slides. So part of this is, finding resilience and developing resilience. One of the things that we look at in terms of resilience is, or three other things, are developing forms of psychological self-care, physical self-care, and then also spiritual self-care. So when we think of coping, there are many, many components to this. And these are three really broad categories. And certainly this isn't all inclusive, but these are kind of major components to, what we describe as resilience, which is another way of just describing our ability to move through the stresses that we're experiencing right now without the wheels falling off, without completely getting burned out. This doesn't mean that we're not experiencing stress. It just means that in the face of these stressors, we continue to function.
And one thing that seems so simple and even silly, but is actually really effective, is just to say out loud, "I am resilient." That has an effect on brain chemistry and your emotions. But the other thing that I thought about when Jason first presented me with this slide was, can I create a sentence from each of these? So I would challenge all of you listening to write down, I practice psychological self-care when, or I practice physical self-care when, I practice spiritual self-care when, and write down these things. And it is really helpful to go back and look at what you've written, especially when you're feeling that angst. It really helps me down for myself and realize that it's not, the worst case scenario, and there are things I can do to support myself in my resiliency.
So, hey Matt, can I see slides on here?
You'd have to bring up your screen share in order to do it. I mean, that's the next slide. Can you see it? Because you should be able to.
I can't see anything.
You should be able to see it coming down. Oh, sorry. Yes, you can't. I apologize. That is my bad. Sorry.
Okay.
Well, can you talk just for a second? I'll fix that here real quick.
Sure.
So
Yes.
Jason, the next slide is the priorities slide that we had about relaxation, gratitude, exercise, and sleep.
Okay. All right. Thank you for the cue there. So yeah, this I don't know if you can see the slide or not.
Yeah.
So this I still can't see it. It's teensy. This slide gives you kind of an overview of 4 broad categories that are really important. And these 4 categories are relaxation, gratitude, physical exercise, and then sleep. And now is a really important time to make sure that these things are prioritized. That's perfect. Make sure that these things are prioritized. A lot of times, this is common knowledge. A lot of people know, hey, these things are good for you. But now is the time for us to prioritize these aspects of self-care, especially if we're experiencing a lot of anxiety or we're experiencing a lot of stress.
And so what I thought was helpful was to go through my daily routines and kind of mentally take note on, are my daily routines helpful or hurtful to these priorities? So is staying up an extra hour to watch the Ozarks helpful? Not really. That's going to affect my sleep and my exercise. But is logging on and listening to my favorite yoga teacher's Yoga Nidra at 8 o'clock at night, that's very helpful. So kind of mentally just taking stock of those things, and if anything, it'll make you feel a little bit guilty.
So right, and I think a lot of people know what's good for them, but they don't necessarily prioritize it. And I think that's really our point, is that right now is the time to prioritize self-care. So I'll move into the next slide, or the next topic that we're gonna cover briefly, which is making sleep a priority. So making sleep a priority is really important because sleep plays a vital role in our mood function, our cardiovascular function and cardiovascular health, our endocrine and metabolism function, and then also our immune function. So these aspects of sleep and how it interacts with our emotional well-being and our physical well-being means that sleep really needs to be prioritized at this time, because if you start to sacrifice sleep, or you have really kind of chaotic, inconsistent sleep, it's going to impact mood, cognitive function, immune function, your metabolism. It's going to have some negative or toxic effect on your well-being.
And you're, keeping in mind that your sleep quality too is entirely dependent on what your self-care routines are. So when you think about what those are, and if you are prioritizing them in line with gratitude and exercise and relaxation, that is going to affect your sleep. And I know there's so many challenges for everybody at home. Kids aren't going to school, and so you might be staying up later. You and your partner might have different sleeping routines or times that you work or go to bed. And so it is key to, if anything, just be cognizant of what those are and set what works best for you and for your family.
Yeah, that's a great point. Being flexible and being aware of what's working, what isn't working. So let me jump to the next slide. I'll get a little technical here, talking about sleep. Sleep medicine is a pretty broad field, but there are some really basic behavioral changes that people can make that really help their sleep and help them derive all the benefits from good sleep. So the thing that I really hammer in my clinical practice is sleep schedule. So making sure that you have a schedule and structure to your sleep, and you have a commitment to sticking to this schedule. One of the most important things, and this is kind of down on that first arrow, is having a discrete sleep window. So these are hours that are your sleep hours. This is when you allow yourself to sleep. This would, for some people, it would be 10 to 6 a.m., whatever it is. It can be really helpful to make sure that you have a regular sleep window. It doesn't need to be absolute. You can flex this to some degree, but what's most important is that you have a really specific wake time. You shoot for 8 hours or whatever you need. Most adults need around 8 hours of sleep, and you have a window of time that you allow yourself to sleep. So obviously, this means that you're not taking long naps during the day. You're not sometimes waking up at 11, sometimes waking up at 6. You want to try to come up with a schedule that's pretty consistent, and you want to commit to sticking to this. The other piece, the middle arrow in this is what we call stimulus control. So what we're trying to do is make sure that the stimulus of the bed and the bedroom environment is associated with feeling sleepy and sleeping. So people who have really good sleep can hardly keep themselves awake once they get into bed, because they have a really strong association with the bed and the bedroom and sleep. And this gets weakened, or this relationship gets weakened, when people do things other than sleep in bed. So watching TV, checking social media, worrying is really common. People lay awake in bed and worry. People do a lot of things in bed besides sleep. And the bedroom and the bedroom environment really should be associated with sleep, sleepiness, relaxation. Not, you shouldn't be checking your email. You shouldn't be looking at COVID Twitters and updates in bed. You shouldn't be worrying about what's going to happen tomorrow. The other piece that's really important is that you have a relaxing bedtime routine. So you're preparing your body for sleep. When you think of that relaxed sleep state, right before you fall asleep, it's characterized by physical relaxation. It's characterized by mental relaxation. So it's really, you can't go from working and being amped up about something and then immediately fall asleep. And a lot of people try to do that. They'll watch the news, they'll be on social media, they'll be playing video games, whatever, and they'll turn off the lights and try to go right to sleep. And it's not that effective. It's really important to have a time that you use to prepare for sleep. And it can be really kind of, it can be like going through the house and making sure the doors are locked and turning off the lights. But it's helpful if there's some relaxation built into that: reading books, taking a bath, stretching, other things. Becca, do you want to talk a little about that as well?
Sure. So 2 things. First, the point about, making sure that you have this routine before you get into bed. I classically, my bedtime is 8:30, and I will classically finish my last activity of the day all the way up until 8:25, and somehow reasonably think that I only need 5 minutes to get ready for bed. And that's certainly not true. And then what inevitably happens is I find myself putzing around the house or petting the dog, or, just doing those relaxing activities. And then before I know it, it's an hour later. And so that is really key. I try to be very conscious of, okay, if I want to be in bed at 8:30, I start getting ready for bed at 7:45 or 8 if I have all of that time. The other thing that I find really important is to find space and find time in your day or your week to practice, mindfulness or meditation, just some place where you have a quiet space to be awake and acknowledge the thoughts that are coming through your mind. Otherwise, what I find happens is I crawl into bed, and it's the first time all day that I have a quiet space to reflect on my day, and that's when the checklist start and the worries from work and the things that I have to do tomorrow. So I know that when I do build in time for meditation or other relaxing activities, even if it is a bath, just somewhere that there's no stimuli and I can be in a quiet space, that those thoughts then don't miraculously start to appear as soon as my head hits the pillow.
Yeah, that's a really good point, Becca. And that reinforces having a relaxation practice, or quiet space in your life that isn't just bedtime, because bedtime is really about sleep, right? It's not about winding down, reviewing the day, solving problems, planning tomorrow. All that stuff should happen outside of the bed and the bedroom environment. And really, I talk to hundreds of people a year about sleep problems, and people are trying to do too much in their head at bedtime, and it really needs to be kind of a sacred space that really bed is for relaxation and sleep. So let's jump to the next slide. This is kind of a matrix of like basics. We've covered a lot of these. The big one down there is really maintaining a sleep schedule. Most of the people I talk to who have really dysregulated sleep, their sleep schedule is just chaos. It's all over. Sometimes they're sleeping in really late. They're going to bed really late, sometimes really early. They're sleeping during the day. It's just chaotic. And we really try to structure it and schedule it, and it helps most people. I already covered the bedroom is only for sleeping. Really, it's sleep and relaxation. It's not worry time. It's not work. It's not a workplace. Taking media out of the bed, work out of the bedroom, worry out of the bedroom, getting physical activity, which we're going to cover in a little bit, and not sleeping in past your window. That's kind of, if there's a take-home point from all of this, it's coming up with a sleep window or a sleep schedule, and really committing to maintaining that, making a commitment. It helps most people. Sleep structure does. So I'm going to jump to the next slide. There is an app that was developed in collaboration by the VA and Stanford University. It covers a lot of the stuff that we're talking about and more. It's cognitive behavioral therapy for insomnia, which is the CBTI, and it's kind of a coaching app that's helpful. So you can write it down, download it. It's free. Gives you some good content in there. Covers pretty much everything that a cognitive behavioral therapist or psychologist would cover if they were working with you on sleep. So let's jump to our next topic, which is physical exercise. And I put a few points up here that are important. Physical exercise, everybody knows that it's something they should be doing for their mental or physical health, but not everybody knows how to do it consistently. It's a challenge for a lot of people. And there are a few things, there are kind of 5 factors here that are helpful for a lot of people. The first one is making exercise, whatever you're going to do, achievable. So if you've never run a day in your life, you don't want to commit to training for a marathon necessarily. You might start out with walking. You need to schedule it or make an appointment. You need to make time for it. So exercise needs to be, like anything else, really important. It needs to have space on your calendar. Making it fun and making it social is also really helpful. So committing to an exercise routine with somebody else makes it a lot easier. I was just talking with one of our providers here yesterday who said that she's trying to run more, and to get herself motivated, she's calling her sister, and who's in a different city, and she's talking to her sister while she runs slowly in the morning. So I thought that was kind of a creative way of making it social. And then setting goals, like having reasonable, achievable goals, even if it's really simple. Like I'm a big fan of people committing to doing something, even if it's just 15 minutes a day, or just walking around the block, committing to something, because in general that always leads to doing other things or doing more. So I know, Becca, you had some thoughts about that as well, some really good ideas.
Yeah, the first thing that I wanted to say is, especially during this time, all of our gyms are closed, all of our yoga studios are closed, all of our jujitsu academies are closed. And so you're really missing out on a lot of what your normal routine is, stopping by the athletic club or Juniper Swim Fitness after work or before work. And so it's going to take a little bit more effort, especially now, trying to get into a new routine and trying to figure out the apps and the Zooms that everybody is offering. And so I just wanted to first acknowledge that that's challenging. And I get that. I'm experiencing that. You know, my friends are experiencing that. And so we're trying to find new ways to connect, because that social part of exercise is certainly an important piece. The other thing that I wanted to say is, a long time ago, one of my yoga teachers told me, the day that you don't feel like doing yoga is the day that you need it the most. And so just kind of this idea that when your body is feeling a little lethargic, or you just don't feel that well, and you think, I'm going to take the day to rest up my immune system, that's actually the day that you really should be doing mild to moderate exercise. And running, 10 miles on that day, but, doing something. And it's interesting, because there are certainly days that I can do a really intense, high intense cardio training, and it's no sweat off my back. But there's other days that it feels really hard. And there's so many things that, go into that, your sleep cycle, your stress, there are all these things that play into it. And so as Dr. Prinster said, just setting very small goals. So if I don't feel like doing any exercise for the day, I will just tell myself, okay, you have to do at least 10 minutes of stretching, or you have to take both dogs around the block for a walk. And usually once I get into that 10 minutes of stretching, I'm like, okay, I'll do 10 more, or okay, I'll run this block with the dog. But setting that goal and being really intentional about it, and creating that routine, and just the exercise has to be associated with something that you enjoy. I don't particularly enjoy running, and so that's not something that makes me feel good to do. And I have difficulty saying, okay, I'm going to get up and run every morning at 5:30. So you have to find the things that are enjoyable for you. Those endorphins are very real, and they have a very big impact on your brain.
Yeah, those are great points. And I think the other thing, I mean, as coming from a psychologist, I'm prescriptive with exercise frequently, because there's evidence that really reinforces the idea that exercise helps our mood, and that's why I put it in this discussion of anxiety. There's good evidence that suggests that walking outdoors in a natural environment decreases anxious and depressive rumination. So when you're caught in a cycle of thinking about all the bad things that are going on, or worry about something, try going for a walk outside. It doesn't need to be, running. It doesn't need to do mountain biking necessarily, although those things would be options as well. But just walking outside has the capacity to break up these cycles of negative thought. And most people feel better about themselves when they do exercise. It's just one of those things that it feels like good self-care, even a little bit. And it makes most people feel a little better. So that's really important in terms of managing anxiety. The other topic that we wanted to touch on was making gratitude a priority. And Becca, why don't you take the lead, because I think you have some really good ideas on this topic.
So gratitude is something that I've spent years, literally years, trying to wrap my head around and get into a routine with, just like anything else. It's not something that always comes naturally. And, of course, there's little things throughout your day that you find, but you really have to put it into a routine, and you have to say it out loud. So as part of, your yoga practice or your running, when you walk out that door, or when you're getting ready to do that physical exercise, just try saying out loud, as silly as it sounds, I am so grateful that I have the ability to walk out my door here in Bend, Oregon, and go for a run. And the other tip that Dr. Prinster had wanted me to share, something that my family started was have our New Year's Eve gratitude jar. And so what we do is every Sunday, everybody has to write down 3 to 5 things that they were grateful for that week or something good that happened in their life. And then every New Year's Eve, we spend our New Year's Eve reading all of those gratitude lists, and just reflecting on the year. But what we enjoy about that is it has both that, short term, we get to that week write down the things we are grateful for, but then it has that long term effect too, where we get to look forward to the end of the year and reflecting back. And for example, this year will be interesting. It's going to be a very, very difficult year for our family and for our organization here. And there's a lot of things that I'm frustrated by and upset by. But I bet come December 31st, there's going to be more good in that jar than the bad that I necessarily felt. So finding the good, finding the joy is very important. And it has to be very intentional. Like I said, it's not something that you just do offhand if you're not consciously thinking about it.
Yeah, that's
on your mirror.
a really, really great idea. Well, and I think also, like, going back to how gratitude can help with anxiety, is gratitude forces you to think about positive things. It forces you to think about the good amidst really stressful, anxiety-provoking events that may be occurring. So when you sit down to come up with 3 things or even 1 thing, whether you're writing it down or just starting your day this way, cognitively, it forces you to think thoughts that are positive and that aren't anxiety provoking or aren't catastrophic. So I always like to think of it as a way of forcing our brains to look at the goodness that might occur in between everything else that's occurring. And it's a really interesting mental exercise to put yourself through. And I always encourage people to try it and see what happens. And most people are surprised that it actually does work. So it's not just something that's you should do. It's something that actually has an effect on your psychological functioning. So definitely a good practice to prioritize as a way of managing stress and anxiety.
Well, and that's a good point too, Jason, that it's a practice. It's not something that you're going to perfect. Practicing gratitude is exactly that. You're going to be really crappy at it some days, and some days you'll be a lot better.
Yeah. Which is a great segue for the next topic that we want to touch on, which is making relaxation a daily priority, especially now. I always encourage people to do this under normal circumstances, but under kind of these circumstances, the pandemic and everything, all the effects, this is especially important. So, relaxation is kind of this big, broad term. From a really kind of technical perspective, relaxation is lowering your heart rate, lowering your respiratory rate, lowering muscle tension. It's reducing the activity of stress hormones in your body. So, relaxation is really kind of toning down that fight or flight response. There are 2 really major ways or major categories to approach relaxation, and one is physical relaxation. So physical relaxation practice, like a relaxation exercise or slowing your breathing down when you're feeling panicky. And then also, how I like to term it is like check your thinking. Like, a lot of times our anxiety is driven by anxiety provoking thoughts, right? We're thinking catastrophic, stressful thoughts, which is driving our fight or flight response and making us feel panicky or really anxious. And usually we can change one or both of those by changing our thinking or changing what we're doing with our bodies. So again, going back to what Becca said earlier, relaxation is a practice, and it takes patience. A lot of times when people are really anxious, I'll sit down with them and talk with them about their anxiety or about their stress, and I'll ask them, what's your relaxation practice, or what do you do normally to manage your physical tension or your emotional tension, your anxiety? And most people don't have a practice. They maybe do things, they'll say, oh, well, I'll go for a bike ride, or I'll go, I'll have a drink, or I'll watch a movie or something like that, but it's not built into their daily routine. So this graphic goes over kind of some broad categories of relaxation. And some of them are physical. So like a lot of people have heard of progressive muscle relaxation, which is a technique where you tense and relax different muscle groups as a way of like releasing muscle tension. Down on the bottom, there's breath-based relaxation, which most people have heard of. It's lowering your respiratory rate, breathing from your diaphragm, trying to trigger your body's natural relaxation response to kind of counter that stress response or that fight or flight response. And then there are also some cognitive techniques like autogenic relaxation, which is focusing on, Becca mentioned mindfulness. Autogenic relaxation kind of falls into that same category where we're noticing things and trying to enhance feelings of calmness. And then visualization, I always like to say it's going to your happy place, right? It's visualizing places, images, sensations that you find really relaxing, and trying to again promote or trigger this relaxation response. So I know Becca has some good ideas too about daily relaxation practice. Do you want to share those?
Sure. So especially for those of you with kids at home and everybody kind of stuck together in confined space, I think it's really important to help give your kids some relaxation activities to do, or things that place them into a calmer space. I know when my kids are calmer, I feel better as a result of that. There's a bunch of different apps out there. There's a Headspace. It's called Headspace, the kids version of it, and it's just these quick little 5-10 minute. My 7-year-old will just get completely out of control, and I'll say, Silas, go do Headspace for 10 minutes, and he sits on the shoe bench and comes back and is in a much better spot. So helping not just yourself, but whether it's your partner, your children, your friends, helping to offer them any advice on getting into that routine is very important. There are a lot of different types of practices out there, like Dr. Prinster mentioned. I really enjoy, there's a practice called Yoga Nidra, which is just you lie down and listen to a script that kind of takes you through relaxing all the areas of muscles in your body, and that's very enjoyable to me. But really any place that you can get into a calm environment where you don't have excess stimuli, take a bath with no TV in there or nothing to distract you, maybe not even a book, and just kind of be alone with yourself and have to be okay with that.
Yeah. There's no right or wrong way to do this. It could be going outside and, hanging a hammock and just listening to music or listening to the wind. The idea is that you're trying to do something besides being actively anxious and stressed out, and however that may manifest in your body and your mind. The idea is to kind of slow things down, to decrease the cumulative effect that this has on you every day. A lot of people do this every once in a while, but it's really important right now to have this be a part of your daily routine, just like brushing your teeth or taking a shower, like those things that we do automatically to take care of ourselves. Relaxation needs to be, it needs to have a place on your schedule. And there are a lot of different resources, like Becca mentioned, many different things that you can do. It's just important to make this happen in your daily life. Go ahead.
It's important to recognize that when you have those thoughts or those feelings, just recognize that those are real. Don't just try and put those aside like, I'm not supposed to feel anxious or I'm not supposed to feel fearful. Just acknowledging that it's okay, to feel that, and it's not going to last forever. And think of it as a passing cloud, acknowledge it, give it a sign, call it a bear, call it a, whatever kind of clouds you imagine in the sky, and let it pass.
Yeah, that's a really good point. Like, this isn't about making anxiety or stress go away. It's about living with it. Right now, I think stress is a roommate that we all have to live with, and there's different ways of living with that roommate and kind of coping with how that affects us. So, The next slide, the next topic is what I mentioned earlier, which is checking your thinking. And I'll just touch on this briefly because this is kind of a big topic. But it's really good. It's really important to pay attention to what is going through your head. Just like people tend to not pay attention to what's going on in their body, a lot of people have trouble looking at what's going on in my head. Like I feel anxious or I feel stressed out, but what is going through my head right now? And these are some examples of kind of some thinking errors that people engage in pretty frequently that lead to anxiety, like ignoring the good and focusing on the bad. A lot of people do that without realizing it. Blowing things out of proportion. Bad things are bad things or stressful things, but they're not always catastrophes. Fortune telling, you're right. I mean, assuming that we know what's going to happen, that the worst case scenario, I know that's going to happen, and then we feel the effects of that. Mistaking feelings for facts is another one. If I feel anxious, something must be wrong. If I feel unattractive, I must be unattractive. This is kind of emotional reasoning, right? We're taking the way we feel and turning it into reality when it's just an emotional reaction or emotional experience. Setting the bar to perfection. I think one of the speakers early in the week talked about this in the context of parenting, right? Like it's unrealistic to expect that everything's going to go perfectly right now, working from home, parenting your kids from home. You can't set the bar to perfection. You have to be flexible. And then the other one is a lot of people engage in shoulding, right? Telling people that things should be different than they are. I should be better. I should feel less anxious. These are all examples of just ways that our thinking can really contribute to our anxiety or our stress. And it's really important just to check it and monitor it and ask yourself, am I doing some things that might be contributing to my feelings of anxiety? Do you have anything to add, Becca?
You did great.
Okay. All right. Next thing that I want to touch on really briefly is social engagement. I know there's a lot of, there's a lot of discussion around this right now, connecting with people. And this isn't always traditionally associated with managing anxiety. But if we look at anxiety and depression, isolation, all those things as just stress in general, making sure that you engage with other people is really important right now. And again, like everything else we've talked about, this needs to be a priority. It needs to be something that you build into your daily routine. And I was just talking with somebody this morning. This doesn't need to be like having a long FaceTime with somebody. It could be just exchanging texts or saying, "Hey, I love you," to somebody you haven't talked to for a while. It could be making a meal with somebody on FaceTime. Or it could just be a really simple check-in. But I think now is the time to really prioritize social connections, friends near and far, people you haven't contacted for a long time, friends, family, any peers, anybody.
And not only for you, but for that other person as well. Maybe you're doing okay, but you check in on somebody and they're not. Can you be a source of strength to them?
Yeah, as a way of giving to other people, like checking on a neighbor, connecting with the neighbor. Yeah. So to kind of wrap things up here, we started out by talking about resilience, and I think we're all in a position right now where we really need to focus on building a resilience routine, and also embracing uncertainty and being okay with challenges and setbacks, which this represents in a lot of ways. That it's part of our life. We need to really focus on the self-care piece so that we can get through, whether this is 1 more month, 2 more months, 18 more months, however long, the effects of this are going to last. But we also have to, reframe things cognitively so that we don't necessarily see these problems as being completely insurmountable. They're just challenges. and we've touched on a lot of different things like the physical, mental components of relaxation, fostering gratitude, grateful view of just your life, yourself, other people, and building social support. This isn't an exhaustive list by any means, but these are some things that both, there's a lot of science supporting these being part of like your daily routine and having it help your sleep, having it help your mood. But these are also really common. These are helpful for a lot of people. Both, we see this in our practice here at High Lakes Healthcare, and then also as Becca and I were talking, these are things that we're trying to practice in our lives, and we're seeing other people practicing as well. Did you have any comments on that, Becca?
The only
To
other
wrap things
comment
up?
I would say is, again, not just building resilience for yourself, but I think about the resiliency of High Lakes Healthcare during this time. We are a resilient organization, and we've had to adapt quickly. And the people that are here doing this with us every day are going through their own personal struggles. And so, it's all of us coming together that make this organization resilient. And I'm really, really proud of the work that, our teams have done in these last few weeks.
Yeah, and the Health Council, and I think in the community and our families, this really is. There's lots of examples of resiliency. I see them: restaurants, different businesses that are trying to build resilience and embracing the uncertainty that we have here. So I wanted to wrap up just with a couple resources, discussion of resources, related to. I already mentioned one related to sleep. There are a lot of online resources. Some of them are really good. I listed a couple. I thought some people might like some of these chatbots, Youper, Wobot, MoodPath. There are these chatbots that you can describe your symptoms to, and these programs, they're AI programs that will give you ideas. Some of the things that we've discussed today, but they'll frame it. Some of them will, I think, MoodPath, like it can check in on you, ask you to rate your mood. So experiment with those. Those are kind of fun. I tried to get one of my teenagers to check it out, but she wasn't that interested. Youper, I thought that was pretty interesting. Those are all free too, as well. There are also some online telehealth services, listed a couple common ones: BetterHelp, Talkspace, 10% Happier. These are methods to access. Some of them are accessing therapists online, via telehealth. And others, it's consultation. So some of these are paid. I think most of these are paid. And you can also, use your insurance. If you have health insurance, they'll accept health insurance. So that's something that can be helpful. And then the last one, Becca mentioned Headspace. I think these are really great. Calm and Headspace are really cool apps that provide some guided relaxation. So a lot of people struggle with trying to engage in relaxation on their own. Headspace or Calm or Mindshift are apps that guide you through it. So that can be really helpful for people who struggle relaxing on their own. I really encourage people to experiment with those, and again, build it into their routine. So Becca, you've got some experience with Headspace. You said you'd like that.
Yep, I like it too because you can do it for both adults and kids.
Yeah. So there's a lot of really cool resources online. These are some of the ones that I think are particularly interesting. And then the last piece of this is that sometimes doing it on your own isn't sufficient. I think there are a lot of great things that we can do for ourselves, but it is really helpful to work with a professional who is skilled at helping people along this path, whether it's focused on like sleep difficulties or managing anxiety. These are just a few examples. Like at High Lakes Healthcare, we have primary care, and then we also have integrated behavioral health. So we've got behavioral health clinicians who can see people once or multiple times. We have a psychiatrist. We also connect people with resources in the community. There are other primary care organizations that have similar services, like St. Charles, Mosaic, among others. There's also the access team. Contacting Deschutes County Behavioral Health is sometimes it's a good resource for people to access. And then I put on Psychology Today. They have a function called Find a Therapist, which you can get on psychologytoday.com. You can type in your zip code, and you can sort through a pretty big list of clinicians in the community. You can sort it based on insurance, gender, age, specialty. So there are a lot of resources out there for people in Deschutes County. Sometimes it's difficult to access those services, but it's really important to not be afraid to ask for help if you're really struggling with sleep, with anxiety, with depression, whatever it might be. This is an unusual time right now, and it's okay to ask for help, and accessing help is easier now than ever because of telehealth. So we're able to offer a lot of services via telehealth, and you can be at home on your smartphone, and you can talk to your primary care physician, your endocrinologist, your psychiatrist. So this is a really great time to be able to access care for a lot of people. Do you have any concluding remarks, Becca?
I don't.
Okay. All right. Well, we've surpassed our time. Dawn, I want to kind of thank everybody for their time, and feel free to reach out if we can be helpful here at High Lakes Healthcare.
Thanks, Dr. Prinster and Becca. If you're up for it, I'd like to go through, we have some questions and comments from audience members. So first of all, we've had a lot of great comments of like, this is really sleep routine. This is very informative. We did have a question from an audience member wondering, if they wake up in the middle of the night, say after 4 hours of sleep, and then they can't get back to sleep, is it better for them to sort of stay in bed, or should they get up and do something like read or something like that? What's better in terms of sleep habits?
That's a great question, really common question. I didn't cover kind of middle of the night awakening, but yeah, the best thing to do, going back to that, stimulus control idea, that idea that you only want to associate the bed with sleep, best thing to do is to get out of bed and do something relaxing. So I always tell people, like, go to the couch, get a book, get a blanket, stay out of bed, doing that relaxing activity, whatever it might be, until you start to get sleepy again. So you're not sleeping, so you shouldn't be in bed, and it's not going to harm you anymore. It's not like you're not going to be any less rested than sitting on your couch reading a book than you would be laying awake staring at the ceiling. So that's a really good question, and really difficult for a lot of people to get themselves out of bed in the middle of the night, but really important. And then the other piece of that is making sure that you stick to your wake time. So even if you're awake reading for 2 hours in the middle of the night, you still have to wake up whenever your wake time is.
Okay, great. Thanks so much for that. One question that I thought of when I heard you guys talking is, I'm not very good about actually scheduling a lot of this stuff into my day. I kind of heard like, oh, you should schedule exercise, but I hadn't really thought about like scheduling time for gratitude, schedule time for relaxation on top of that. And I know I myself got a little bit overwhelmed of like, oh my gosh, I better start like entering all this stuff into my calendar. Gratitude time, exercise time, home time. So if you're like me, an audience member at home or viewing this recorded, if you were to say like, okay, if you're not doing any of these things right now, where do we start, right? Like if it might seem overwhelming to start all of those things immediately, where would you suggest is a good kind of starting place to get on this schedule?
I can take that one, Jason.
Okay.
So what I have found is it doesn't work for me to necessarily schedule it in the day, but do it following something. So you probably don't brush your teeth at the same time every day. You certainly don't schedule brushing your teeth into your schedule, but you do floss after you brush your teeth, right? So if you think about gratitude, when you step over the threshold of your bedroom door, say something that you're grateful for. Or after you're done getting out of the shower, do 5 jumping jacks. So instead of thinking of it as a schedule, okay, at 8 a.m. I'm going to do 5 jumping jacks, try and think about it as after I do this, which is something you already do normally, I'm going to do this. And I find that that is very successful.
Yeah, I couldn't say it any better. And I think the other piece is starting with what you think would be most important, right? Don't go off of what we say is important, but like identify a place where you think would make sense to start is helpful as well. And then assess, like, does that make a difference? So, but Becca's point is really good. Like, it doesn't need to be on your calendar. It's better to build it into the fabric of just your daily routine in some way. And that's a great technique that she outlined.
Yeah, I really like that. Just like brushing your teeth or showering, like you were talking about earlier.
Yeah.
That makes a lot more sense to me. That makes me feel less stressed about having to add everything. So thank you so much. I don't think we have any other questions from the audience members. So thank you so much, Dr. Prinster and Becca from High Lakes Healthcare for joining us today. This is super helpful information right now, given everything that we're going to. I also just wanted to give a quick shout out to our virtual production partner, Hand in Hand Productions. Remember to like us on Facebook, and we're now live on YouTube as well. We have a YouTube channel, and we hope to see you for our live events tomorrow. Thank you so much.
Thank you, Dawn.
Thank you.